Well, Scott, I certainly think it's important that we're having this discussion today because the heroin epidemic, the opioid crisis, is not just something that's in a pocket of our neighborhood here in Kettering, but it's in all neighborhoods and the entire community. And certainly, in most cases, it's attaching to every family. There is something or someone in every family that may be touched by this crisis. So as a community, I think it's great that we're talking about this. And why don't you tell us a little bit about what's going on at the schools?
Absolutely. Thanks, Mark. Yeah, about 18 months ago, we started on this journey. We went down and had a meeting that was presented by Attorney General Mike DeWine, and he brought to our attention that day of what I don't think any of us were really prepared for, which was this epidemic that has truly hit our communities. And it has impacted our communities. It has impacted our students. It has impacted our parents. It has impacted our first responders, and it's put a drain on the resources of both the city and the schools. But yet, I think we've prioritized and tried to find a way that we can go about meeting the needs of our families in Kettering and all of our schools that are in Kettering. And it's led to us really taking a look at safety and security.
It does indeed. And what's fortunate for our community is it starts not only with the administrators and the staff of both organizations, but the elected officials of both organizations as well. So the impact that we're seeing from the public safety side really hammers home the fact that this is not just a crime situation. It's an epidemic. It's an addiction. And I think our police department is working, with other agencies so that we can get help for the folks. When we show up at a house and we have to administer Narcan, it's not about making an arrest. It's about trying to get help for the individuals who need the help and creating a network of resources within our community as well as within this region so that folks can get assistance with this, because certainly it's going to take, they say it takes a village. Well, it's certainly going to take our entire community, not just the city and the schools, but also all of the resource providers that are in our community to get educated on the issue.
One of the things for us that's been really interesting is in talking to students, and they're really the ones to really ask. Basically, they're saying, heroin isn't really a problem for me, but I can tell you that my cousin or my parents or other relatives are using it. The big problem for us is that gateway drug, which is marijuana and alcohol. And that is a problem. And we realize that we have to address that too. So out of this major issue, which has been the opioid heroin issue, we're still trying to address that too. And it's an education piece for us. That's a very powerful tool. And I think it can really make a difference.
Hi, I'm Chip Protzman, Chief of Police with the Kettering Police Department.
Hi, I'm Tom Butts, Kettering's Fire Chief.
We're here to talk to you today about the heroin issue that we're having, just not in the Montgomery County area or across the country, but the issue it's causing for the city of Kettering as well.
Well, I would like to discuss how the opioid and heroin overdose issues have affected the Kettering Fire Department. It has been a dramatic effect to our department and the amount of run numbers that have increased and our usages of Narcan or the naloxone. In the past years, we have seen a gradual increase in overdoses, and then this year has been astronomical. To give you an example, last year our department administered 103 dosages of Narcan for overdose patients. This year alone, just from January to May 15th, we have already used 177 dosages of Narcan. That alone speaks volumes of the issue that is resulting in our city. It is also happening throughout our entire community. We cannot pinpoint it to one area of our city. It is spread throughout the entire region. These typical emergencies, we receive a 911 call on an unconscious patient or unconscious patients, because we are starting to see now multiple usages and multiple patients on one scene at a time. Our crews will arrive. Most patients are in an unconscious and barely breathing or not breathing state. We will treat those patients. If the revival is successful, most likely the patient is revived on scene. They will become alert and they will refuse any more treatment from us, from the Kettering Fire Department. So we are not taking a lot of these patients to the hospital. If the patient does get removed to the hospital, 9 times out of 10, these patients are not even treated at the hospital because they will walk out before the hospital has even an opportunity to treat the patients. So we are seeing that trend throughout our area and throughout the region as well. In years past, multiple alarms would come in and it would be mostly fire and medical, but we would be treating mostly our citizens for falls, injuries, and alike. Today's the typical calls from our crews that they see are the overdose scenarios. So it is not unusual for our crews to answer these overdose calls day in and day out, and multiple alarms during the daytime to treat the overdose symptoms.
The Kettering Police Department has seen a massive increase in drug overdoses and drug arrest, and a lot of that stems from the heroin epidemic that we are dealing with. We have done several things to try to combat this. We split it 2 ways. One is the law enforcement perspective, and the other is treatment perspective. So with the law enforcement perspective, we have put a number of people in our vice unit. 2 years ago, we had 1 officer who was working there. We now have 4 officers and a supervisor who are in that unit. They do undercover work. They follow up on drug complaints from our citizens, and overall just keep a watch of what's going on with the heroin epidemic and other drug issues that we are having. We've also added an additional canine to our unit. We now have 3 canines for the Kettering Police Department. Those dogs are cross-trained. One of the trainings that they have is drug indicator dogs. So if someone is stopped in a vehicle or we're in a house and we feel that there are narcotics, particularly that people are hiding, we'll bring the dogs in to search, and when they indicate, the officers will then look closer. A lot of people believe that we need a warrant to search cars. That's not the case. If a canine would hit or indicate on a vehicle, officers then have the right to go in and search that vehicle. Another thing that we are doing on the enforcement side is we are now training our officers better on drug interdictions, and they're looking for that closer. So officers working the street are now paying attention to where the drugs are coming from, those who they think are transporting them in or using them, and are using traffic stops and other methods to try to combat that. On the treatment side, we understand that you just can't get away from this problem by arresting people. We also want to be there to help. So a few things that we are doing. We are working with some of the social services agencies. One of the things that we're trying to get going is a front door program, and that is if someone comes to the police department or to a police officer and lets them know that they have a drug problem and they want help, that we will be able to get them to a treatment facility right away, and that person will be able to walk in the door and start their program right away instead of having to wait. We have also written a grant for a mental health coordinator. This person will be responsible for building a better relationship with the police department and those with mental health. And as we all know, and as research indicates, that mental health and drug use sometimes go hand in hand, so we believe that that will be beneficial to us as well. And just overall for the schools, we've added a school resource officer for Fairmont High School. We now have 3 officers who are SROs, and they do programs in the schools. The biggest one is the Red Ribbon program for the middle schools, where officers educate those students on the hazards of drug use, what to look for, how to say no, and how to get help for themselves or others if they need to.
I'm Mitch Robbins, Assistant Chief of the Kettering Fire Department, currently assigned in the role of operations. I'm here to talk to you about the heroin epidemic and how it has hit the region. This has caused the Kettering Fire Department to increase our training and awareness in fentanyl and carfentanil and heroin type incidents. The crews have to use their training and awareness to understand that any type of alarm, even for an unconscious, unknown, or unknown type dispatch, could possibly be a heroin overdose or an opioid overdose.
Hi, I'm Dan Von Handorf, the Director of Student Services from Kettering City Schools.
Matthew Barnes, I'm a police officer here for Kettering Police Department, community relations officer, and my main job is to act as a school resource officer in our schools.
Chasing the Dragon is a documentary that we set up with the high school last summer. One of our school resource officers, Officer Drayton, and one of our school counselors, and I went down to the FBI's educational outreach program. They had a showing for all the school districts in Southwest Ohio, and offered that program as something that school districts could do to help inform the student population on the dangers of opiates and prescription drugs. We took them up on that offer. This year, all of our students watched that documentary, and we spent 4 days in advisory, which is like homeroom, talking about what they witnessed there. That culminated in about an hour-long panel discussion with experts. Our kids submitted questions to them, and those experts answered them for students. It was a great event. I think our kids got a lot out of it. Our teachers got a lot out of it, but it was a great way to share knowledge on this growing crisis in our community. Our health classes touch on that. A lot of what they do is through current events, and so one example that the high school gave, every 9th grader had to do a current event article on opiates or on overdoses or on heroin, and they discussed those in their classroom. But a big part of that is Red Ribbon Week, and we lean on our school resource officers who do just a fantastic job talking to our kids. And so I'd like to turn it over to Officer Barnes to talk a little bit about the middle school and Red Ribbon Week and what you do there.
Okay. A big undertaking for us in the fall of every school year is Red Ribbon Week. It's a nationwide drug initiative program that we have expanded, and every year it seems to grow. This year, what we've done with our drug program is coordinate that educational component through Red Ribbon Week to reach every middle school kid in the district. Our hope is that every kid gets it when they enter the middle school, and then just we touch upon it as they continue to graduate into the high school program. So by the time they hit the high school, they should have a pretty good knowledge of how people get addicted to drugs, why they get addicted to drugs, what that looks like, what the ramifications and consequences are, how to recognize and get help for people that might be dealing with something like that, which, as we can all agree, has become more prevalent.
And in addition to our middle schools, the SROs also present at Alter High School as well, similar information. And then for the first time this year, one of our counselors had asked the school resource officers to go in and talk to 5th graders.
At the elementary level, we presented some basic information pertaining to gateway drugs, drugs that are unfortunately becoming more common, but certainly which can expand and grow to include opioids. Even, prescription pills a lot of times are what these kids are seeing in their residential environments.
One other thing that I want to touch on, as a school district, we work with Wright State University. Every other year we survey our 7th graders, 9th graders, and 12th graders to look for trends in drugs, alcohol. Most of our kids are doing the right things. They are living good, healthy lives. They're making good choices, but we really want to target those areas where our survey data says we need. Our partnership with the city, and specifically the police department and school resource officers, is just fantastic. Another example of collaboration, this summer we're hosting Operation Street Smart, which is a group from Columbus that comes down and teaches educators, law enforcement on all the new trends that are out there with alcohol and drugs. And so we're going to have about 200 people at that presentation. The adults continue to grow our knowledge so that we can continue to help kids. It's been a great partnership, and I think our kids and adults are learning a lot of information about this really important topic that's affecting our community.
My name is Jennifer Kane, and I'm a member of the Kettering Board of Education.
My name is Bill Lauder, and I'm a member of the Kettering City Council.
Partners for Healthy Youth began back in the early 2000s. The City of Kettering and Kettering City Schools recognized that youth and family in Kettering were facing some challenges unique to them. And so Partners for Healthy Youth was established so that the city and the schools could work together to address these issues facing families and youth in Kettering. Partners for Healthy Youth is comprised of a member of the Board of Education as well as a member of City Council, and the respective stakeholders within each of those organizations, folks like school counselors and youth program coordinators. We also have leaders within the business community and faith-based organizations, as well as medical professionals. As always, we are committed to prevention, and as Kettering faces the opioid crisis, Partners for Healthy Youth continues that commitment.
As a result, our Partners for Healthy Youth group put together a panel of community representatives. On the school side, we had administrators, we had counselors, we had nurses From the city side, we had representatives from our fire department, from our police department, our planning department, and our parks and recreation department. This panel group talked about the issues they were facing and brainstormed how we could possibly deal with those issues. And the outcome from that process was the idea and the decision to look at creating a new position that would be jointly shared between the city and the Board of Education. And that position is a position called the Youth and Family Resource Coordinator. We want them obviously to be an advocate for the services that our youth and family need. We feel that this person will be a great resource for the children and families in the community, as well as provided necessary and needed support in dealing with this whole opioid issue that the community is facing. Well, this certainly is going to be a big job for the right person, Jennifer. Not only are they going to provide the support for children and families, but they're going to help address the opioid issue in our community.
Yeah. And Bill, Partners for Healthy Youth certainly is proud to be part of this endeavor.
And we're appreciative of the efforts of the Board of Education members. I know my fellow City Council members, and I think this is another example of how the two organizations, City Council and Board of Education, work together in the City of Kettering.
Yeah.